Hello everyone, my name is MACIEJ LESIAK and I want to share with you today a simple side branch functional evaluation with a jailed FFR wire during provisional stenting of the main vessel. Provisional technique with a single stent is associated with a good outcome in most of bifurcation cases. And after provisional stenting, the presence of negative fractional flow reserve, even with residual and geographically significant stenosis, is associated with a good outcome. So in some small studies, a jailing of the pressure wire in the side branch just to permit direct FFR assessment has been performed with successful retrieval of the wires. However, no data exists on the reliability of the measurements obtained this way with jailed FFI wire. So let me present a case of 90-year-old woman with stable severe angina, a couple of comorbidities, who had PCI of right coronary artery a few months earlier, with mild aortic stenosis, hypertension, hyperlipidemia, and type 2 diabetes, with no significant changes in echo and ECG. So this is her angiogram. Well, good result, long-term result of right coronary stenting and some mild disease at the bifurcation of the LAD and diagonal, as you can appreciate on this still frame image. Due to the fact that the lady was very symptomatic and the lesions didn't look very severe, we decided to perform functional assessment of both lesions. And for that, we used opto wire by Opsense Medical, a wire with an optical sensor which is located in a housing window with round edges just to reduce the stent catch, the risk of stent catch, and some bubble trap and the risk reduce the risk of drift, with concentric design and robust shaft support. So why concentric design is so important, you can see this at this nice illustration. In the middle, you see the concentric opto wire that generally behaves as any regular workhorse wires, unlikely to other wires when there's concentricity is not preserved. So coming back to our patient, this is LAD functional assessment, and you can appreciate that the result was significant. DPR was 0.78, and on a pullback assessment, the gradient jump was observed around the bifurcation. Then we pull back the wire from the LAD and pass it down to the diagonal, and you see this measurements of diagonal 0.8, and again with the pullback from diagonal to LAD, the highest gradient was observed around the ostium of the diagonal branch. So knowing this, we decided to stent the vessel, the main vessel, just provisional strategy. What you can see here is the predilatation of LAD with NC balloon 2.5/15 with the Opsense wire left in the diagonal branch. Following this, we implanted drug-eluting stents 275/18 millimeters. So now the Opsense wire is jailed in diagonal. And of course, to respect fractal geometry of bifurcation, we optimize the proximal part of the of LAD with pot NC balloon 325/8 millimeters high pressure. So this is the angiographic result. As often seen in this kind of procedures, we see a pinch at the ostium of the diagonal. So we always want to know whether this kind of lesion is significant or not. So why not using now this jailed wire in the diagonal? So we reconnected the wire again and just appreciate how significant the lesion was, DPR of 0.54. So the question is, whether this kind of measurements with a jailed wire is reliable. These are the data presented last year in EuroPCR in vitro assessment of jailed and free-floating wire in the side branch. 22 measurements with a very good correlation. So at least in vitro, we know that the result should be exactly the same. So to correct this, we decided to perform kissing balloon inflation. So two short NC balloons, 2.5 over 12 in diagonal, 3.0 over 12 in the LAD, low pressure inflation, and checking again. Of course, we rewire with a workhorse wire towards diagonal, and now we check again with the absence wire, and you see that the functional assessment is no longer positive, so we have DPR of 0.81. Then we checked with the same wire functional significance of lesions in the LAD, and also with good negative result of DPR of 0.87. And that's the final angiographic result, completely acceptable with no significant pinch at the ostium of the side branch. So to conclude this short case, I want to say that this kind of simple technique of obtaining a reliable functional side branch assessment with a jailed FFR wire is, I think, a significant advantage of the provisional stenting strategy. But of course, safety, reliability, and safety of jailing FFI wire must be warranted. Thank you very much for your attention.